Hello everyone. Today we are going to learn about indicators of health. Health indicators indicate the health status of individuals or populations. Health indicators are measurable characteristics that help us understand the health status of individuals or populations. Indicators are required not only to measure the health status of a community but also to compare. When you want to compare the health status of two different countries, you can compare with the help of health indicators. For assessment of healthcare needs, for monitoring and evaluation of health services, activities, and programs to measure the extent to which the objectives and targets of program are being attained. Characteristics of indicators. Validity. It should measure exactly what it is supposed to measure. Example, infant mortality rate should truly reflect the health conditions affecting infant deaths. It should reflect the actual causes such as poor maternal nutrition, inadequate prenatal and postnatal care, infections, low birth weight, and prematurity, congenital anomalies. Reliability. The indicator should give consistent results when they measured repeatedly under the same conditions. Example, different surveys measuring vaccination coverage should give similar results if reliable. Sensitivity. It should detect small changes in the health status of a population. Example, a slight rise in the incidence of tuberculosis should be picked up by a sensitive indicator. Specificity. It should only reflect changes in the specific aspect of health it is meant to measure. Example, an indicator for malnutrition should not be influenced by unrelated health issues. For example, a child might lose weight due to a temporary illness like diarrhea, but that doesn't necessarily mean the child is malnourished long term. So, a indicator should be specific. It should show changes due only to malnutrition, not due to other health conditions. Feasibility. The indicator should be easy to collect, measure, and apply in real world settings. Example, indicators using simple data like birth or death records are more feasible than complex lab tests. Relevance. The indicator should be meaningful and useful for health planning and decision making. Example, HIV prevalence is more relevant in public health planning than rare diseases in some areas. Mortality indicators. Crude death rate. It is defined as number of deaths per thousand population per year in a given community. It indicates the rate at which people are dying. Crude death rate, number of deaths in a given place during the year divided by mid-year population of the same place and time into 1000. Consider city A and city B. In city A, the crude death rate is lower, and in city B, the crude death rate is higher. You may think the city B is having poor health services, so it has a higher crude death rate, but it is wrong because the higher crude death rate is due to the death of the older population, whereas in case of city A, it is due to the death of younger population. So, the disadvantage of crude death rate is gives no information about age distribution of death and about Cause of death. Crude death rate does not consider the age structure. So, even though the city B has a higher crude death rate, it might simply have more elderly people. Expectation of life. So, if a baby is born today and you want to know the average number of years that will be lived by those born alive, you need to consider current age specific mortality rates. That means if most of the people die after the age of 70, so life expectancy of the newborn can be around or above 70 years. So the life expectancy increases when early age death decreases, even if old age deaths remain high. Life expectancy is a good indicator of socio-economic development. In general, life expectancy is a positive mortality indicator. Age specific death rate. So, you need to consider, for example, period as 2025 and area as Andhra, and if the age group is mentioned as 20 to 24 years, so the age specific death rate is defined as total number of death occurring in a specific age group of population in a defined area during a specific period per thousand estimated total population of the same age group of the people in the same area during the same period. And infant mortality rate. Infant mortality rate is the ratio of deaths under 1 year of age in a given year to the total number of live births in the same year, usually expressed as rate per thousand live births. Infant mortality rate. Number of deaths of infant under 1 year of age divided by number of live births into 1000. It is one of the most universally accepted indicator of health status, not only of infant but also the whole population and of the socio-economic condition under which they live. Under 5 proportionate mortality rate. The total number of deaths during same period, consider the period as 2025. In the total number of death, how many children are died under the 5 years of age into 100 gives the under 5 proportionate mortality rate. Maternal mortality ratio. So the total number of live births, that means if a mother is going to deliver the baby and the babies are alive, that total number of live births and the total number of death of women while pregnant or within 42 days of termination of pregnancy, irrespective of the cause of death, into 1000 gives the maternal mortality ratio. Case fatality rate. It measures the risk of person dying from a certain disease within a given time period. For example, if the person is having rabies and he is definitely going to die if not treated early, because rabies is the condition where most of the people die. So the total number of cases of rabies, in that cases how many of the people are going to die due to the disease. So case fatality rate measures the virulence of pathogen, it reflects the killing power of the disease. Limitations of case fatality rate. Time interval is not specified. Usefulness is limited for chronic disease. So, the case fatality rate of rabies is 100%, yellow fever 80%, Japanese encephalitis 30 to 35%, chickenpox less than 1%. Proportional mortality rate. The total number of deaths due to all causes. In that total number of deaths, how many people are dying due to the particular disease? It tells the burden of a disease. So if the most of the people are died due to a particular disease among the total death, it indicates that most of the cases in the society is due to that particular disease. We can take the measures to control that disease. So it tells the burden of a disease in the community.